Good morning. I am Jo Gibson, and welcome to our first People-Centred Services webinar. And I have the privilege of working alongside a number of people sharing and practicing Vanguard method applied in people-centred services, which is really exciting stuff. So it's going to last about an hour, this session. And I'll talk a little bit about the Vanguard method and why it's so helpful in understanding and evaluating people-centred services. So people-centred services being those probably you're familiar with, health, social care, within social care, adult social care, children's services, housing, anything where we as human beings should be at the centre, and likewise in third sector organisations, so advice services, homelessness services, etc. I'm going to talk about how the method helps all of these systems and services evaluate current practice, current system and process, particularly from the citizen's perspective. I'm going to give you a case study, just a talk through later on in the session, a case study that is based around some learning from students who came on the course a couple of years ago, particularly in the commissioning of home care. Okay, so our studies in people-centred services have shown us and helped us understand a number of things along with organisations and individuals in these services and systems, and that their focus is primarily in current world on assessing rather than understanding, filling in forms and carrying out those assessment processes. The focus is also on transactions rather than building relationships, and relationships being at the core of everything we do in people-centred services. We tend to refer cases on rather than taking individual responsibility for them. And of course, that is as a consequence of not designing a system around those working in the system and living in the system that enables us to problem solve for both ourselves, for communities, but also in services. And we tend to prescribe packages of care, and they tend to be activity-based, very traditional, instead of taking time to understand what might improve someone's life, and more importantly, what strengths and skills and abilities they have, or indeed the networks around them, that are encompassed within those and within the wider community. And certainly that is something that is coming very much to the fore. But clearly, one of the issues is unless you combine those good, strong, healthy conversations, understanding conversations, with changing a system and creating a system that values relationships at the heart of what is done, then it can be very difficult. So the result is that the problems that people face are often not resolved, and certainly not resolved first time. Our studies of all of these systems when understanding demand in shows that a significant amount of that demand is what we call failure demand. And the result, of course, is escalation of need and issues and problems that people face. So that not only has a very negative impact on the human being, you and I, but also has a huge impact on cost. And whenever you study the system, understand the system from the citizen's perspective, one of the key elements to understand as well is the human cost and also the cost in terms of actual resource. And I know that many of you who are probably listening to this and watching this webinar, this will resonate. You'll have seen it in your own systems and understood it from your own systems. And the key challenge, I guess, is how can we change this? Because we certainly need to. Things are not sustainable the way they currently are. And that, again, we see all the time. And the question is, what might a concrete alternative look like? Because it's all well and good understanding your system, and many of you will already do that and know that, but we need to understand the what of the system, but also the why, the thinking that drives and governs why the system currently looks and feels the way it does from the citizen's perspective. That's really important. So the method that we use, Vanguard method, is unique in that it starts by evaluating the current performance of the system, trying to understand what it currently looks like from the citizen's perspective, why it looks the way it does, and therefore what we could and should do differently based on informed choice. we've had a number of students, so we now run a course in partnership with Kingston University, and we've had a number of students who have participated in both the Czech part of the course, which is the evaluation, understanding the what and why of the current system. And also we run then a second course called Redesign. So having understood what the system currently looks like and the need for change in it and the levers for that change, we then carry out and have a redesign course which focuses on, so what would a concrete alternative look like? How do we get there, and how do we experiment with that? And it's very much an emergent process. It's not something that is predetermined in any way. So we've had a number of students who have done both courses, and the case study that I'm about to show you is as a consequence really of two students. They actually were on separate Czech courses, but were from the same locality, same geography, but then did the redesign course together and were able to hold a conversation around home care and the recognition by the commissioner in the locality that they needed to do something different. So they've both participated in the course, and they've then been able to experiment. The two organisations are Gwynedd Council and Cartrefi Care, although there are now a number of other care organisations in the locality. In fact, all of them have spent time around about 6 to 8 days with Vanguard, understanding their system from their citizens' perspective. And they have seen the model in action on the university course, and then between the taught sessions, so we do taught sessions with theory, some real grounding in both systems theory and intervention theory. I'll talk a little bit more about that in a minute. So they've seen that and experienced that in the tutorials, and then we've done on-site normative learning in the work. Those of you familiar with Vanguard method will be familiar also with that term. So it's learning in the work, applying what you're learning theoretically, actually applied in the work on a day-to-day basis. And then between the sessions, the students will carry out activities, homework, etc. And hopefully next week, we have a number of students who will be doing, preparing to do a written piece of submission for their assessment on the course. So it's certainly exciting and very beneficial. And these slides relate to the home care. The first part is the home care. And the second part are some results from some other systems as well that we've studied and we've helped organisations study. So just a little bit more about the context really of this piece of work that's still ongoing in Gwynedd. In fact, we were there a couple of weeks ago and sort of seeing on the ground the difference, the fantastic difference it's making for people in their lives in the communities in and around Gwynedd. The commissioner there, Melis, used the Vanguard method to try out a new way of working in community health and social care. In fact, it was a piece of work that was originated through an innovation fund in Wales, through Welsh Assembly, and it was both Health, Ffion and Morwenna in social care who initiated and led that work, and that's still ongoing and has led to the development of 5 localities and sub-localities, so very much locality-based design in communities. So that was sort of the start of the work, and that led to the identification of a new purpose for the whole of the service, so in both health and social care. And that's, as some of you will appreciate, that's quite a tricky thing to get to, because organisations have their own purposes. Often they are what we call de facto purposes, not necessarily focused on the citizen. And getting to a point of absolute agreement on why we're here and from whose perspective we exist is really imperative. And so they came to, as you can see, the purpose being help me live my life as I want to live it, which really does sum up, when you hold understanding conversations with citizens, what matters conversations. This again and again and again is thematic. It comes through, and surprisingly, all of us as humans want this. But of course, there are lots of factors that contribute to what a good life looks like, and what is important in holding good thorough understanding conversations that are founded on relationships and developing relationships with individuals is that real understanding of what a good life means to the individual. So they couldn't meet the new purpose, they realised, if they continued to commission what they'd always commissioned. For them, it was a huge blockage for the team and for the organisation. So they knew they had to do something different. And of course, the provider also recognised this. And it was very interesting to be part of those conversations within the redesign course. Because, of course, up until that point, it had been quite a contractual relationship. Very much, we would say, in Vanguard terms, command and control, and therefore limited really the ability of people to speak freely about really what was important and what should be important, because of course those conversations are very much governed by contract and contractual terms. So they recognised that this was a big blockage, and they found a partner, as we said. The initial partner was Cotrefi, and that really was a stroke of luck as a consequence of them being on the redesign course together. And they also plugged into an ongoing piece of work, which is the Regional Home Care Project and the local implementation of that. And whilst there have been some blockages as a consequence of that, there's also been some things that have really helped smooth the path really for commissioning in a very different way. And just on that note, we run commissioning events every so often around the country. We will probably be holding one later on this year. And the whole purpose of those events is to just challenge the concept of current commissioning and the protocols around that. And we refer to a number of supportive research and documents that equip organisations who really want to challenge the current commissioning structure. And this, of course, is what Maylis and Gwyneth have done. So, just a little bit about what they found when they did CHEK and did the CHEK course. So as part of the CHEK course, you understand demand, clarity on purpose, understand demand and the nature of demand coming into the service currently. You understand the capability of the system to respond to that demand, how effective is it, and being able to understand and respond. The flow of the work through the process, but also more importantly, mapping of cases and case journeys to see how it impacts on the individual, and then understanding the blockages, system conditions that get in the way, and ultimately the thinking. And when Gwyneth and Cotrefi did this, these are the sorts of things that they found. You'll be familiar with these, very much focused on time and task commissioning. You can read the sort of tasks that are carried out, very activity-based. And on the right-hand side is the spreadsheet that is used by one of the providers to just keep track. And this employs 3 people full-time, 3 managers, focusing on filling the gaps, moving things around, following up on chase-ups, chasing other people up, etc., etc. Again, any of you who either operate, work in, or are familiar with these services, this sort of thing will be familiar to you. And as they say there, you become the time slot and you become the task. So both from the citizen's perspective, it feels like that, and also from the worker's perspective, it feels like that, and very little satisfaction within that. So they also wanted to understand what managers paid attention to. So this is, again, one of the organisations, Cotrefi, but it has been replicated, this work, in a number of the other providers, and we spent quite a bit of time with them over the summer, last summer, taking them through the application of CHEK. And this is what all of them have found, very similar sort of cut, I guess, in terms of time spent. And as you can see there, unsurprisingly, I'm sure it'll be familiar with lots of you there, the majority of the time is spent on invoicing staff, invoicing organisations, managing the rota, timesheets, filling in paperwork, ticking boxes. One organisation that we worked with showed us an enormous assessment form that was around about 40 pages long, repeating all of the questions, of course, that had been asked previously for the citizen, and no wonder really that citizens sort of got a bit frustrated when they were asked the questions multiple times. All the stuff that we're very familiar with, but we still continue to design into our systems. And again, the consequence of that is, as you can see from the green segment, very little time spent face-to-face by the manager with the person or the family, improving quality, which of course should be the primary role of a leader or a manager in a service. Is how do we just get it better all the time for the citizens who live in our locality? How do we get it better for our teams and value them in valuing relationships and building relationships? So really interesting piece of data, again validated in many other people-centred services. Those of you who've studied social care will know and be familiar with 80% of the time of social work is spent on paperwork, filling in forms, etc. The question is, how do we change this and challenge it? Because we really do need to. So the system conditions within health and social care commissioning in Gwynedd were as listed. Again, things that will be familiar to you, I'm sure. Providers being told what they must do and they must do it, which of course leads to this very adversarial relationship and makes working in a different way and building a different relationship quite challenging. Brokers are used often as a source to source the care, and again, most organisations will be familiar with brokerage and having broker organisations. And some interesting things are happening, certainly within Gwynedd, regarding brokerage. Care's bought in hours and paid for in hours, so very little focus on what matters and having held understanding conversations. A lot of time is spent financially reconciling various things. And contract monitoring is a regular feature, but of course it is to evaluate against the legal agreements, not actually the value that we're creating in the communities or the value that we're creating for citizens. Lots of time spent making sure that the money comes from the right pot, based on the specific classifications of care. And of course that often involves health as well, and lots of battles going on between health and social care. And then commissioning teams working hard to try and keep hourly rates down. That's the focus of attention, rather than what value can be created. So those will be things that, again, probably familiar to you, but these are things that when Gwynedd, along with Cartrefi and others, have studied their system, these are the things that they've learned. And these things can become key levers for then thinking about what a concrete alternative could and should look like. So this slide, I guess, summarises a lot. It summarises over 12 months of work and more, probably, in terms of where they were. So at the left-hand side, this model being one of us and them. So between the commissioner or social care assessing, providing care and support plans, going to brokerage to try and source care, finding a provider, and then passing that over to the provider, who then delivers on the service plan, and then care starts. But of course, as you've seen, when you study the system, there's a lot more goes on in all of those 5 steps, and a lot of waste activity, which is one of the things that you evidence when you evaluate the system in this way. So they're moving to this new way of working where there's a real blurring of roles. And that's an ongoing process, but quite challenging, because of course people do like their roles, they do like clarity, and they also often hold to their professional roles. And many have written about the over-professionalisation in people-centred services, rather than really just focusing on what matters to the individual. And as they've said, their relationships evolve, as does the care and support. It's all founded on relationship, the citizen being at the centre, and the primary value work, the work that is valued most by the commissioner, and therefore really needs to be by those commissioned, is that people listen together to understand together. I think it's a really nice term, because it's about this getting alongside people, and really understanding truly what is important to them, what will make their life a good life, and doing all we can to ensure that that is met. The assessment never ends, it's ongoing, the relationship is ongoing for as long as the individual needs it. The care and support's tailored to the person with the person. And interestingly, this is not about redesigning service. If anything, it's not about service. It's about identifying the strengths and skills that individuals have and that they can use, or indeed those around them can use to achieve a good life. And it's based on a true partnership and mutual respect and trust. And again, this is developing. Understandably, those commissioned providers have been a little bit sceptical and a bit wary of a commissioner who suddenly is saying, actually, we want to value you, we want to value the citizen primarily, and we really want to work together, not in an adversarial way. And as you'll see in a few minutes, there are some significant impacts of this approach. So very much the service, or whatever you wish to call it, is as flexible as it needs to be, designed absolutely around the individual. So the emergent data, so they have been experimenting now for well over 6 months. From phase 1, which was the first experimentation with Cotrephy in a very small area, and we would recommend experimenting very small scale to test out the principles of a redesign. And we talk about this a lot more in the redesign course, but it shows very clearly that capacity can be freed up. And as you can see there, the total number of hours that were prescribed according to the assessed care was in excess of 1,000 hours, but the total number of delivered hours was 655. So 59% fewer hours delivered than prescribed. Now this was from phase 1, but having spent some time, John and I, with Maylis the other week and the teams there, this is replicable in every locality now where they are piloting before they then recommission across the whole locality. And just so that you can see the impact that it is having, so the practicalities of commissioning and what that means in monetary terms, because of course private providers do need to be able to survive. And as you can see, the changes are not in the overall amount that each provider gets, not at all. But the changes are in the amount that goes to pay for the value work, which is that of the home carers, because they are holding good understanding conversations, face-to-face, spending more time responding to exactly what matters to the individual. So as you can see there, staffing on costs are increasing still, and that's because of obviously adapting to and designing around the locality demand, which is just starting to learn more about, being based in the 5 localities, but then sub-localities. But the biggest and most significant change is in, as you can see, the management cost. And that relates back, I guess, to the pie chart I showed earlier. And there is an expectation that organisations can work towards driving out those waste activities if they are not commissioned on a time and task basis, but are commissioned on the basis of doing value work. And that essentially is what Maylis and Gwyneth are doing. They want providers to be commissioned, those that will do the value work, hold good understanding conversations, and design based on locality, so that costs that are there around rotas just dissipate, they disappear. So it was never ever an intent of this work that the teams would be self-managed. It's an emergent redesign, and therefore it comes from the people in the work, because they're the best people to know how best to design the work in a locality. But the consequence has most definitely been self-managed teams and self-managing teams, and that's great to see. I've got some really good feedback from the teams where this is the case, very invigorated, motivated, and just able to respond to the needs of the citizens in their locality, which of course is having a knock-on effect in terms of cost. So that's the sort of logistics of it, and the costs and the economics. And again, when you study on the university course in Czech, we spent a whole segment on system economics and understanding system economics, because it is important to do that as a before and after. So change in business model is from, as you can see, an hourly rate, and staff pay being low, no guarantee of work for providers, providers not having to take care packages on or refusing to do in some instances, and demand constantly exceeding supply, moving to, as you can see on the right hand side, a very different basis for a relationship. It's a patch-based model on a block contract, money divided equitably between the localities based on understanding demand and the nature of demand in those localities, and that's where this work links in to the locality-based design. And better staff pay. The hope is, the intent I think is within Gwynedd, that the amount paid to the carers will increase more beyond this, once providers and organisations really focus on driving out waste and the causes of waste. But of course that's only been possible by commissioning in a different way, because a lot of the waste activity is as a consequence of having to manage contracts in a traditional way. So just towards the end of this, we just wanted to show you some examples from other services or other localities rather. This is work that was done in another locality, again in health and social care. They reviewed 43 cases, and in the old system, it would have cost 107,000 just over to commission those services, but in the new system, 26,000 just over. So you can see the saving in 6 months. And of course, they were then able to extrapolate that. So if it were done across all of the cases in a 6-month period, it would equate to 485,883 per annum. So again, the important focus of all of this work is on the citizen. It's not on the money, nor should it be. And this really comes as a consequence of focusing on the citizen, and that is an important point really in this work. And again, this is a cross services really study that we did in one of the larger Mets, or across a number of Mets actually. So the historic approach, as you can see, cost around about £106,000. Almost 107 on this long-running case, known to multiple organisations. And when they then decided, the organisations studying this system, evaluating it, they learnt enough to know that they had to do something different, and then experimented with different. What they discovered was actually, by being more people-centred, focusing on the individual, the savings could be immense. And the costs were around about 2,210. And when we did some work very, very early on in this particular field in troubled families, did this work in 2 large local authorities, the results were very similar. By engaging with citizens in a different way, a non-adversarial way, building relationships, really understanding what matters to them, and more importantly, holding these strength-based conversations, much more can be achieved. And actually, most people can be helped to help themselves. So in summary, we are hoping that we can help and support through this method a change in the shape of our communities, because it all rests really on relationships, building those relationships with individuals, but then extending that to the communities, neighbourhoods that we all live in. And current world, sort of, there's a lot of us who are in balance, but there's also quite a significant chunk of us who end up in the middle part of the triangle, and we could go either way. Where we want to get to is, and where we have with the sort of work that I've just shown you before across services, is moving more and more people from that middle layer, and citizens and families from that middle layer, to one of, yep, I can live my life independent of service, but I know who to pull on and how to pull on them because I've got a good relationship with them. So the overall principles, which you really will have seen, I guess, in the case, are, in applying this method, are, it's a means of understanding the citizen and what matters to the citizen, both in the communities in which they live, but also within their lives, within their neighbourhoods, and always doing so from their perspective. The method is very normative, it's done in the work, and it combines two important things, and that is systems theory and intervention theory. And I said I would come back to this earlier on. Those of you familiar with Vanguard and Vanguard's work will know and understand this, but the systems theory is very much about how do we improve the system and create a system where people in the work and in communities just are able to do the value work, which is hold good understanding conversations, listen to each other in a constructive way, and be able to identify the best means of helping each other out. And that, combined with intervention theory, which is very much rooted in how we help people change, particularly change their thinking, again is very powerful. One without the other is not sustainable. One on its own will achieve so much, but it will not be sustainable. And the big challenge is the combination of those two. And again, any of you who have read the work that we do, and those of you who maybe have thought about going on the course, will see that we spend quite a lot of time applying Gerard Egan's work, The Skilled Helper. It's a 3-stage model, and it links in very well with Vanguard method, but is very much focused on understanding. And those of you perhaps have, like me, a bit long in the tooth, a bit old and getting on, and were social workers at the time of Gerard Egan's book being a set text, you'll be familiar with his work. I know a few people who we've come across are familiar with that work and the benefits it brings. So it's truly an emergent methodology, as I said before. There's no blueprint, there's no plan as such, although clearly as you move from check-in to redesign phase, you start to provide a structure and a framework for teams that are experimenting. It is an experiment, it's done on a very small scale so that it's manageable and we can learn, understand and improve as we go along, which of course is what Gwyneth have done and are now in a place where they've got clarity on how they will recommission, what they will recommission on, and how that will be understood and measured in a constructive way to help gain understanding, knowledge and improvement. So all of this is very much based in people-centred services on building and maintaining human relationships. They're the thing that are of real value, more value than any forms and assessments.